Okay, so Be'ez Hashem, today we are going to talk about the concept of Yisurim. If you have a patient that is suffering a lot, end of life, so you have basically the dilemma is between the concept of, I would say, the value of life, Kedusha Sachaim, everyone understands and knows the value of life. On the other side, we'll talk today also, there is such a thing, value of Yisurim, of suffering. Does suffering, is Bichlal a way that we could say that we could be lenient about it and not to treat, or do something, active treatment? All these type of things we're going to talk about today. So before we go into the details, first, we have to understand, what is this in the Torah view? Does Yisurim have any value to it? Is it a positive thing? Is it a negative thing? So I'll bring you different sources that you'll see that Yisurim is not, understood as something totally positive. And we'll see it as we go on with the shir. But be'etzem, what we're trying to understand today is the value, basically the conflict between the value of life and the value of Yisurim, and in between. We're going to talk about the bias of a person on his body. Who owns us, right? We all know that we don't own ourselves. Is that true in any case? Or I have some say in certain cases. We're not going to talk about family, if a family member has what to say about that. That's already a different topic that we won't have the time to go into it. And also quality of life. When we talk about quality of life, what type of quality of life? What happens when you have a person that is an ALS patient, for example, right? An ALS patient, it's very, very hard to say that an ALS is Chaye Shah, because ALS is 2, 3, 4, 5 years he could live with this condition. He's definitely going down, and deteriorating from day to day. That's clearly. But on the other hand, he is something, someone that is healthy. So what is, in terms of Yisurim regarding ALS, what do we have to say to him? Okay, so these are the questions that we're going to talk about and deal with today. And Be'ez Hashem, let's start seeing. Okay, so first, let's talk about the concept of Yisurim. There's a Gemara, the Gemara in Kiddushin, the Gemara says on the pasuk, Ma yitraem Adam. Here the pasuk says, Ma yitonen Adam chai gever al chatav. What is the person complaining? So the Gemara says a few things, but then the Gemara brings here an opinion where the Gemara says, "Chaim shenatati v'chi gavar al chatav dayo chaim shenatati lo." The Gemara says, "What are you complaining? I gave you life. Great, be happy for life that you have." Meaning, what does that mean? So look at the next source. The Medrash explains it. And the Medrash says that meaning, I am the one that supplied you life and you are complaining. What are you complaining so much? That is, what does that mean? What do you mean, what am I complaining? So in the Mefarish here, he says, even though you have a lot of tzaros, what are you complaining? They understand from this Gemara, from this Medrash, and from this the Eitz Yosef as a Mefarish on the Medrash, that they say that that Yisurim, even though it's not something good for a person, meaning the person thinks that it's not good, but what are you complaining? The fact that HaKadosh Baruch Hu let you to live, we don't understand why we live and everything, and and therefore that is not something for you. So we see that the value of Yisurim is something that we should basically understand. I'm just bringing you, different just touches. Here also the Gemara says that this here is a negative connotation of Isur. The Gemara says 3 people, their life are not life, meaning even though it looks like they're living, but their life is not life. And the Gemara says, someone, okay, that always looks at his neighbor's grass, as we say, right? Your neighbor's grass is always greener than yours, so his life is never life. And someone that Ishtoi Maishel is Olav. And the third thing that the Gemara says as that Isurim Moishlim Begufay, somebody that is full of Isurim. The word Moishel comes from the word conquers, that it's on top of him and basically does everything, conquers him and overcomes him on everything. Such a person is what? A Baal Isurim, and his life is not a life. So this is a negative connotation regarding Isurim. Another negative connotation where the Gemara brings different Tanoim that that had Isurim, and all of them said, Amar lechavim said no, Amar loihen v'loi scharon. We know that Isurim bring sechar, but most of the Tanoim that are brought here in the Gemara, they said thank you, but no thank you, meaning we don't need it and don't give it. Okay, so these are negative connotation of Isurim. Here we have a positive towards approach towards Isurim, and where the Gemara here says, here, look at this. The Gemara says here, this is interesting to read these Gemaras just to see the way they spoke to each other. So the Gemara says here, Tana Rabban Shechola Rabbi Lezer was sick. So there were 4 Skanim that came to visit him. Rabbi Tarfon, Rabbi Shua, Rabbi Lezer, Rabbi Kiva Nana, Rabbi Tarfon, V'omar Toiv Atar Yisrael Miti Poshel Gishara. They wanted to cheer him up. So they told him, you're greater than a drop of rain. The rain is good here in this world, and you are good here in the world to come. Then they told him, you're better than the sun. Then they told him also, you're better than a father and a mother. And then Nana Rabbi, so what did they answer them? Nana Rabbi Kiva Omar Chavivin Isurim. Says Rabbi Kiva that what? That Isurim are precious. Omar Lohem Samchuni Veshma Divrei Rabbi Kiva. Let me hear what Rabbi Kiva says. Meaning, all of them gave him very, very nice and encouraging messages. And what did Rabbi Kiva say? Isurim are good. That's not such a great feeling, right? And so, that Isurim is a good thing. And what did he say? One second. Let me hear what Rabbi Kiva said. The Rabbi Kiva Talmidi Shamar Chavivin Isurim. I want to hear what Rabbi Kiva has to say. So here you see a positive approach to Isurim. Here the Gemara in Maseches Shabbos. The Gemara here talks about the following. Rabbi Yossi says, I prefer to die with the ones that have choyle in their intestines. So Rashi says, what's special about that? That's one of the worst illnesses, in the stomach, and that's why he prefers it. So that is another positive approach to something very, very suffering. Another thing, and this is very interesting. This is the Gemara in Maseches Soita. We know that a Soita comes to the Beis HaMikdash and she drinks from the Maimah, she drinks from the water, and we want to know if she did an Aveira or she didn't do an Aveira. If she did an Aveira, so what happens is that she starts a terrible process of her body starts to fall apart, and the Gemara describes a terrible way. But the Gemara, the Mishnah says the following: Yesh schus, okay, yesh lo schus toile lo, yesh schus toile shana achas, yesh schus toile bei shanim, yesh schus toile gimel shanim. Meaning, the Mishnah described that if she is a good woman and she has some schusim from before, the good things that she did before, even though she did a terrible sin, but we say that this procedure of what she's going to go through, this terrible procedure of her body falling apart, is going to be slower, and she's going to live a year, and according to the schusim, a year or 2 or 3. So we see here, okay, everybody is medayik from this, that what? That even though basically what she is going in through something that she's going to suffer terribly, she's suffering, right? This is something that is very, very, very hard. Even so, we say what? That this woman is she's getting another year or 2 or 3 according to her schusim. So we see from that this woman, even though she committed a terrible sin, she gets the privilege of living longer, even though the Chaim are with Isur. Okay, this is another source from the Gemara. The Meiris, what I said, you could see it in the Meiri. The Meiri says, and that is right, meaning she's going to die slowly. And how long is it going to take? That is according to her schusim, even though it's suffering. So we see that suffering is a schus. Who owns our body? So we'll bring a pasuk in Yecheskel. Hen konaf nefashot, says HaKadosh Baruch Hu, li heino kenefesh ha'av kenefesh haben, li heino hanefesh hachotati tamut. A father, a son, everybody belongs to me. Okay, that's a very simple pasuk. Says the Aruch HaShulchan, we paskin that la'alocha, ve'ava b'shanu ro'im shemitzter arbe b'ksisato. The Aruch HaShulchan says the following: we know that we have halacha, the Mishnah Maseches Smachos, and it's paskin the halacha. The Mishnah says that anybody that is a goises, so as long as he's a goises, okay, he is considered to be chai l'chol dvarav. He is alive, and therefore, if there is a case of yibum, the ones that are learning Daf Hayomi knows that now. So he is still Zaykik Yibum because he's alive, even though in a few minutes, as long as he's alive, he is Zaykik Yibum. And he also Paters Bina Yibum if it's a baby. So we say that when the father died and he was alive even though he was a goytzes, the father left a zera and that's it. And therefore there's no such thing Yibum. Also, you're not allowed to do anything that will cause him to die. Okay, you're not allowed, you have to, meaning even though he is in his end of his life, still we say that what? He is considered to be alive. But even though he's suffering, and even though it's good for him, you're not allowed to close his eyes, you're not allowed to do anything. Everything, the whole world belongs to HaKadosh Baruch Hu, and this is the will of HaKadosh Baruch Hu, that we cannot do anything to him. And not only that, we can't deal with the Oroin and the Tachrichim. You can't start dealing with all the things that is needed for his death. It's too early, and you have to wait for that. You can't deal with it. Okay? So you see from here that even though we see that this person is suffering a lot, we don't own his body, and HaKadosh Baruch Hu wants him to suffer. So again, I just brought that as an example. The Tzitz Eliezer in 3 lines said it. Ki nefesh ha'adam einana kinyan sheshum bet muta. Nefesh ha'adam is not a kinyan, right? It doesn't belong to a human being. It can't be such a thing. And it doesn't belong to yourself. Just who does it belong to? HaKadosh Baruch Hu. And he brings the pasuk in Yecheskel. Okay. So that is that. Now let's go and I try to understand when we talk about a Chayei Shah. Okay, we'll see the opinion here of, okay, there is 4 opinions basically of treating a person that has Chayei Shah. Chayei Shah is not a goyses yet, but we want to treat somebody that has Chayei Shah. We don't have a treatment that we could treat him to solve his illness, but we want, but the question is, can we not treat him because we want him to die because he's suffering? We could give him some type of a treatment, but the treatment is only to take off the surim. Okay, and what's called prolonging his life. So we have to do it, or we allowed to sheval taisa not to do that. So there is a few opinions. Okay, Reb Asher spoke about it, touched it, but there is a few opinions. So the famous opinion of Reb Moshe. Reb Moshe says here, this is already a second tshuva that he speaks to a doctor, and he says to a rabbi and a doctor here, and he says the following. He says, שהרי הדין שכתבתי הוא דין מבואר ופשוט, שאם אין יודעים הרופאים שום רפואה, if the doctors don't have a solution for the medical case, לא רק לרפואתו, אלא אף לא להקל האיסורים, and they don't have anything to give him for the איסורים, אלא להאריך קצת חייו כמו שהן באיסורים, so they could treat him in order that he could live longer with the איסורים, אין להם ליתן רפואות כאלו. There's nothing hearing it from Reb Moshe. This is where Reb Moshe says, don't give him the medication or whatever you want to give him, because why? This person is suffering, and don't give him. And Reb Moshe brings a raya. I won't read it inside, I'll explain it to you. There's a Gemara in Ksubas Daf Kuf Daled where the Gemara tells us a story. Rebbe was suffering a lot. Rebbe was in the end of his life and he was suffering a lot. And all the Talmidim, and Rebbe was, imagine to yourself, in the eyes of today, Reb Chaim Kanievsky. And Reb Chaim Kanievsky didn't give us a chance to daven for him. But Rebbe suffered a lot. The Gemara is described there that he suffered of in his stomach, something in his stomach, and the Talmidim were davening in the Beis Medrash, and everybody were davening that Malach HaMovis would not be able to take away the life of Rebbe. And these Talmidim were great Talmidim, and they were able to hold Rebbe. But Amsei, the Rebbe, the servant, the woman that took care of Rebbe, she saw that Rebbe is suffering so much, and the Gemara described something that we could never understand, but the Gemara described that she saw him suffering, that he had to take off his tefillin so many times and putting it on again because he had problems in his stomach. What type of suffering is that? But again, not everything we could be on a darga of understanding. So he said, so I'm saying the Rebbe pulled a trick and she broke something, and all the Talmidim stopped for a second to daven and noch nafshi the Rebbe. So what do we see from that? And the Ran Halacha there brings down the whole thing. So Reb Moshe brings there that you see, even though it's, you could argue, and Reb Moshe himself also understands that, but he says that you see in certain cases that we stop from treating, even there it was tefillah, but the idea is that the way Reb Moshe used that Gemara, it's like a way of treatment that we are treating Rebbe by fighting the Shamayim and keep trying to keep Rebbe here. And if we can't, we don't do anything. So also here, keeping away what's called Sheval Taisen, not doing any type of treatment, is also something that we could do. So therefore, Ramosha brings a proof from that. Here, Ramosha says also, Ramosha says here's something very interesting. Ramosha says basically, we are dealing, why are we treating him? V'rape. You want to treat a patient because you want to give him refuah. So if you are v'rape and he has isurim, so he says since it's isurim and you can't salve him, so salve his you can't treat his illness. Therefore, that is not considered to be refuah. The gamla the salik isurim. And therefore, he wants to say that's not part of v'rape. Okay, this I also have to explain a little bit to understand. We know, okay, the Shulchan Aruch in Simin Shin Lamed Vav and Yoredeh, when the Shulchan Aruch talks about a goisis, so the Shulchan Aruch says the following. It says the Shulchan Aruch that whenever you have a goisis that is about to die, so you're not allowed to touch the goisis, and you're not allowed to do any active thing that will cause to bring quicker his demise. But if there is something that is not on him that is prolonging his death, listen to this, prolonging his death. So then, for example, there is the example that the Shulchan Aruch uses, the Ramah there uses when there is a knockoff, there is a blacksmith or something like that that is banging, and that noise is stopping from his neshama to go out, or there is keys of Beis HaKnesses, and don't ask me what's that shot because I don't know to explain, and I didn't find anybody that explained it. But whatever, these are things that are not begufoi on him that you don't touch, but they are prolonging his death. In such a case, we say that what? That you are allowed to, says Ramoshev. So we see, we have a raya that not everything, as long as you don't do a ma'aseh beyodayim, we could take and we could basically not treat somebody that has Isur. Why? Because Ramosha understands that the concept there is that the neshama of the goises is suffering by you prolonging his death. That's tam a lumdish of understanding of Ramosha in the Gemara, in the pshat of why is it that we cannot, that we are allowed to do different things to not to prolong the death. Okay, so that is Ramosha. Also here, Ramosha says another point that if somebody will, and this is only a Gadol B'Yisrael like Ramosha, somebody says to Ramosha, yeah, if you allow the doctors in certain cases to Sheval Taisa, not to be Merapes, so maybe there's Rishayim that will understand that and take it to a different, cases, and they'll also do that. Ramosha says, I'm not concerned about that. If they're people, if they're what's called Incha Deloy Male, so that's their problem. But in general, I'm not going to change the halacha. There is a Shevet HaLevi, Rav Vosner, that says almost the same like Reb Moshe, but he has one thing, and he says here, basically he brings like this. We just mentioned now that by Hilchas Goises we are allowed to take things that are moinea yetzias nishmosai, right? We're allowed to take away things that are preventing the neshama of going out. We're allowed to do all of these type of things. On the other side, we say that what? That we are allowed to be mechalel Shabbos on a goises. So all the Smag and the Shkus Yaakov and the others, Poiskim, ask a question. Isn't that a contradiction. If you're Mechal Shabbos for a goysis, so that means that you want the goysis to live longer. So what's going on over here? On one side, you say that you're allowed to do a different type of things if you're not touching his body, that they're prolonging his death. You're allowed to remove them in order to allow him to die. And here you say that that if it's Shabbos, you're allowed to be Mechal Shabbos. How could that be? So the answer to that is that no. Of course, right? Of course that we are allowed to be Mechal Shabbos for a, right? We're allowed to be, of course we're allowed to be Mechal Shabbos for a goysis. Why? Because we want to do good for the goysis. We want to give him life. And we're not talking in a case where you're prolonging his death. Prolonging his death, for sure, you're not allowed to do that also on Shabbos. What we're saying is it's not a contradiction. This is value of helping him to live, and this is the value of prolonging his death. These are two worlds. But the one thing Rav Osner says here, the אף על פי שבסתם טיפולים בסופק סכנה חיוב גמור מאתר או אפילו רובי למיסו, והחיוב לא רק דרך ספק, אלא ודאי, כאשר ביארתי באורך שוצ'ו ותלוי, בגויסס נהי דחיוב לקה מקום הכל מותרו ודויכה שבס, וכל האיסורים מיופרט זה עדיין צורכו. לפי זה עושה שפר גם דין הרמו ביורדה, שמותר לאסיר המונע, דלוי מבוי עם נעימה. So he says here, basically, what we said before, just he has one thing that he adds here is that he wants to say that if this is somebody that has serious isurim, you should know that in such a case there's a mitzvah here. Here he says, where is this? ריבו איסורי מיסה וכאבים מתרבים והולכים דים רואים שעל ידי הערכה זו בשעות איסורי מיסוסה מתרבים וזה בוודאי לא תבטא התורה חייגרנה בגויסס ומצווה למנוע ממנו זה בלי לנגוע בו. Says the Shevet HaLevi. One, why did I bring the Shevet HaLevi? Because this is an addition to Reb Moshe. He adds that if you see that this person is suffering so much, not only that you're allowed to, it's a mitzvah to remove and make sure everything that this person should allow him to die. Okay. Rabbi Yakubovich used to be the chief rabbi of Ireland. He is on the other side, not with Reb Moshe and the Shevet HaLevi. He is a big machmir. If it, whatever we could say, it's a machmir or a not a machmir. I don't want to. I don't. These are type of things that it's not machmir. A lot of times, years ago, I went once to a conference by Rav Osner himself for a Banim for Hilchos Yom Kippurim. So Rav Osner said that he said, we are machmir in pikuach nefesh. It's not that we are meikol in Hilchos Yom Kippurim. We're machmir in pikuach nefesh. He says here, Ava b'cholesh amro rofim shetzarich lechalel ta Shabbat alav v'eino rotzeh kulam elo pligi dein shomim lo v'kofim oto laso. This is a very interesting thing. The Mechaber in Yerdeh Siman Kuf Nun Zayin. This is brought also in the Sharat Tziyun and others in Hilchos Shabbos, that they say what happens if you have a case of a choyle on Shabbos. You have an ill person on Shabbos that you are allowed to be Mechal Shabbos on him, but he doesn't want you to be Mechal Shabbos on him either because he thinks that Shabbos is more important, or he doesn't want. He wants to die. In such a case, the Darkei Tshuva there says that that if he is willing to give himself to death in order not to be over Aveira, and we don't listen to him and we force him to we force him to receive treatment. Okay, meaning we don't listen to him. So he wants to say that's all true, but that's all true if it's, he's not listening. But he comes and he says, Rabbi Yakovovich here, that if the reason that you're doing it is because of suffering, it's the same thing, and we should force him and give it to him. And he says, if a doctor doesn't treat him, he uses a lashon here, nechshav kereitzeach. He goes here and uses all the sources here of somebody that ties someone in front of a fire. He uses all these sugyas. Okay, you could look inside. I brought it for you. But he is of the opinion that if there is a treatment that you could give, even if it's only going to give him a very, very, very short lifespan, you should do that. Interesting enough that the Tzitz Eliezer is also in that opinion. Very interesting. And the Tzitz Eliezer says, ומכאן תשובה נמרצת ומחאה חריפה כלפי אלה מהרופאים זמננו שמצד... One second. Before that, okay, here he says, ואף על פי שאנו רואים שמצטער הרבה בקציתתו וטוב לו המוות, מכל מקום אסור לו לעשות דבר לקרב מיתתו והעולם ומלואו שהקדוש ברוך הוא וכך רצונו יזבורך שמוי. And here, that is the lashon that we saw in the Aruch HaShulchan. And he wants to say, then he brings that a person is not allowed to harm himself, right? This is a sugya that we talk about. If a person wants to do any type of cosmetic treatment or something like that, that's the sources that we use for that. And then he says here, that we are allowed to take him and here he brings the Gemara in Shabbos, where the Gemara says that anyone that has goises, that he touches a goises, it's like distinguishing a candle when it's about to blow out. So even though it was about to blow out, but it had another few seconds, so that is an Isur. And here he says, and he basically talks about euthanasia, and he says, ומכאן תשובה נמרצת ומחאה חריפה כלפי אלו מרופאי זמננו המצדדים בהתרת רצח מתוך חמלה. Okay, there is in modern medicine today what's called that people are coming from compassion because this person is suffering, and he wants to say that in such a case, if you do a ma'aseh beyodayim, so he calls it a Ritzicha. Okay, and then so that is Ritzicha. That everybody agrees that is considered to be a ma'aseh of Ritzicha, but, and here he brings different sources, but then he says if a doctor makes a plan not to treat him also, so he also there, he says that is Asr, and he doesn't say that is Ritzicha, but very, very close to Ritzicha. Okay, now, okay, you should look inside. Here he brings different ideas. So the Tzitz Eliezer and Rabbi Yakovovich, the chief rabbi of Ireland, are from the side that say that it's basically, even though a person is suffering, you should treat him. Okay, we don't have time to go through everything. So here he brings also a child nebuch. This is an interesting story that happened in Boston, in Chicago, where we're talking about a grandson of a Baron Soloveitchik that had an 11-year-old child. Tragic story here, that what happened was that he had a tumor in his brain. Okay, and basically there was a problem that they had to take out a lot of liquids from the brain. Now, if they don't touch him, so he'll die quicker. If they do some type of procedure, so he'll live a little bit longer. So there was an argument between the father and the mother what to do. And the father here, he says, Reb Moshe listened to the doctors, and the doctors said that they want to do the procedure, and they said to do some type of a tube from the brain to take out the liquids. The father agreed, the mother did not agree, and it went to court. And the court said that the decision should be made by the mother, and the kid obviously died 2 days later. So the Tzitz Eliezer was asked what to do, and the Tzitz, what's his das there? And he says, "Ledati dat Torah b'zehi she'atzedek haya b'zei mavi hayeled she'iskim la'ashtil b'gugol te'el tzidorit." The father agreed to put the tube. He's right. Why? Because it would give him a little bit of life, and therefore he allowed. So look at the words here and learn it. It's very, 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 very important. And I want to touch, before we end here, touch one more source on that, and another topic of Reb Moshe also touched upon it yesterday, and he spoke about what type of treatment we do in end of life and what type of not. So this is a famous stipler, where usually the stipler wasn't known as a poisik, but the stipler here says, he says, I heard as a child, I don't know where I heard it from, but demותר להסיר דבר המונע פטירת חולה, שאין זה מונע איסורים רבים. You're allowed to. ורק מעשה בגופה אסור לעשות. Meaning, you're not allowed to touch a goyses, but you're allowed to do things that will bring his demise quicker if you don't touch him. ואם כן, להיות בשבע על תייסה לחורה, במקום שעל די זה יתווספו לו איסורים, לא מצאתי איסורים, ועד רבה יש ללמוד, למנוע מזה, and he brings here, the Beis Lechem Yehuda and Yeredeya. These are all things that, if you see the PDFs that I said that I have on Dushas HaChaim, you'll see it there. שאין לתת מלח להאריך ואולי, אבל לחורי כל שאינו אלך ישוב ואין בו הצלה ממש, דומי לנידון הגויסס. So the stipler basically says that whatever, if you don't touch him, you are allowed to do that. Stipler says that. Okay. The Reb Osher in his psak, and I think that is something that basically Mori Rabbi says it, and I think that makes the most sense here, that he says it is up to the person, and that's interesting. He makes a compromise here, and he wants to say that even though we know that a person is not a bailim on his guf, not a bailim on his guf, but a person could say, don't cause me yisurim. Why are you, right? Don't do harm. So b'meila, the person could say, you are here to, again, when we say, even though he probably in most cases he can't talk, but the idea, the concept is that a person could say, I prefer to die and don't treat me. Again, when we're in a case where it's not when in a stama simple case where a person the doctor has a solution for him to live and he says, no, I don't want. Okay, that's something else. But here, when it's clearly that he's suffering and there's no treatment that could give him to live a long life, that's us. Okay, look at the tshuva inside. Heroic measures. What is heroic measures? Okay, here also look at the tshuva of the Mincha Shleima. We don't have the time to go through it, but you should look at it. Every word here really is a lot what to learn in this tshuva. Heroic measures. What is considered to end of life issues? Halacha lemais. Arachat chayav. This is the Nishmas Avram. Arachat chayav shel hagoses v'asovev sheva al taisid. Right? DNR. So he brings from Reb Shlomo Zalman that we have to make a difference between different types of treatment. The natural necessities of a patient, okay, that is something that you have to give. So here he gives us an example. If you have a patient that has cancer spread all of his body and he's close to death and he has a lot of isurim, a lot of pain, you can't stop giving him chamtzan, oxygen, or nourishment, or kol mazon, or nozel mazin acher, right? Or meaning give it to him in an IV or something like that. That you can't stop. If he has sugar, so don't stop the insulin. Meaning all of these type of things are what's called stabilizing. Okay, let's be very clear. Stabilizing the things that you should do, anything that is to stabilize. Don't stop blood, or blood, he probably means to say blood pressure medication, or kol תרופה אחרת כגון אנטיביוטיקה הדרושה לטיפולו. Also don't stop that. But that is why, only if you want to stop that because you want to cause and to enhance his death, to bring closer his death. So that you shouldn't stop. But here he says, there's no chiyuv in such a case, to do anything of kum v'aseh, where the treatment will cause him a lot of pain. Okay, for example, the case of the procedure, okay, that the Tzitz Eliezer spoke about. The Tzitz Eliezer spoke about a procedure that we have someone that we know very clearly that is a procedure. If that procedure doesn't hurt, and so even though it's with kum v'aseh, you may do. But if that procedure itself is going to cause him more suffering, so that is not stabilizing, and that don't do that. Because why? Because you're not merapeh macharato hayesodit. Remember, that's the yesod. In all these cases, you're not helping his main refuah. Rav Nevitzal here talks about, and this is another question, morphine. Narcotic medication is one of the tricky and problematic medications that we talk about, because when you have somebody that is suffering, that's the only way of helping him. On the other side, if you give him too much, you may cause him to die quicker. So Shlomo Zalman, and he quotes him, Rav Nevitzal, you're allowed to give morphine, and Rav Asher said it a few times, and you're also that you're allowed to. And in the case of his wife died of lungs cancer a few years ago, 60 years old, and Rav Asher there, I remember we spoke about it. She was given morphine in order to help her, and he said it may be that it brought her demise quicker, but that wasn't a maisa, it was a maisa for helping her, and that's why it's mutter. There is poskim that say that it's usher, and if you look at this tshuva, Rav Nevitzal questions his Rebbe Reb Shlomo Zalman, but lemaisa he says, my Rebbe said, and we can't argue with him. Okay, he wants to say maybe it's even called Retzicha B'Yodayim. Now, here it's interesting. Another type of treatment in such a case, he brings here, Professor Steinberg, that in such a case, when a person is bardas, you even have to feed him against his will. Umikol makom, listen to this. Meaning a person that is terminally ill, and he's suffering, mutar lafsik ta'azana al vridit. Listen to this. He says the following. What happens if you have a person that is suffering very much at the end of his life, and he's getting his nourishment through an IV or through a peg or something like that. He says you're allowed to stop that nourishment and start feeding him through his mouth, even though you know that feeding through his mouth will be what? You won't be able to give him all of his nourishment. And he's very, very, very weak. And that happens a lot in the end of life. Fortunately, I saw a lot of cases like that where a person, usually very old people, they don't even have the power or will, or I don't know if it's, where it comes from, to chew or something like that. And they try to let them, to teach them how to do, and not always you could find a vein to put it in an IV or something like that. In such a case, he wants to say you're allowed to feed him through the mouth, even though in the end of the day, he'll probably die because he won't have enough nourishment. And he says it in the name of Rav Shlomo Zalman and Rav Vosner. Okay, here you have, here Rabbi Moshe says that to do a maaseh b'yodayim, it's also usur. And in the end here, we don't have the time to go through everything, but Rav Shlomo Zalman says that if you don't want to give you don't want to give medication for blood pressure in a case where he's not unconscious, also you shouldn't do that. You shouldn't do that. Dialysis is for sure an heroic measurement, and you're not allowed to. Anyhow, everybody said there's a lot what we could talk, but this is what I have to say for today, and Bez Hashem will continue.